Hi, everyone. My name is Jamie Smith here on Nurse Tech, and today we are excited to interview Miss Clara Bruno. Hi, Miss Clara.
Hi, thank you for having me. I appreciate you all.
Yes, ma'am. We are excited to interview you. So, can you tell us, our listeners, our viewers? I know you are relatively new to nursing, and it took a windy path to get where you are. What did
Yeah.
you do before nursing, and what led you to the field?
For I started my career as an adult period as in private equity. I was in finance for about 4.5 years, many years ago, back when I was 20 years old, and then got out of that completely and went was home. Well, actually, I was in there. I was at another firm for like a year or so, and then I decided to just stay home with to raise my son, my last kid, and then was a stay-at-home mom for maybe a year and a half to 2 years. I even picked up nannying for a little bit and then kind of worked my way back into working full time. Went from doing nannying to then interpreting for the medical field, and started interpreting also in the school setting, and that kind of sparked an interest in nursing once I was in like the hospitals interpreting for like the low income community or whatnot. And it just showed me that there was like a dire need for advocacy, not only within the health setting, but also within the educational setting. And I loved that part of interpreting. So then when I started talking to other people within my own community and talked to some of my friends who were nurses, they're like, you should really get into nursing. Advocacy is a huge part of it. And so I started then looking at schools, went back to school again, got my associates at Morton College, and you know, decided to go back to school while my youngest was in kindergarten, and that was a kind of a big bust with COVID happening. I ended up doing, teaching, going through nursing school, being like a mom. It just like you just become like everything when they were at home that whole time. So that was very interesting to go through that, and then not being able to get the full on nursing practice that you would get as a nursing student was kind of hard because I'm a like on hands learner. But we did what we could. I started working as a PCT to kind of gain experience, juggled a few jobs here and there just to kind of make it work with my kids being home full time, which was very interesting. And it was difficult, but we made it happen. I have a really strong network at home of like a support system they were able to get me through it, and worked at an LTAC for a couple of months, about 8 months or so. And I loved it there. That's where I worked as a PCT, worked there as a nurse. I had an amazing preceptor, and then decided, that setting was not the right setting for me, but definitely started exploring other specialties, ended up with school nursing, and I never thought that I would be a school nurse. But I love it. I love working with 3 to 5 year olds. I'm in the preschool setting at this time, but we have a team of nurses that we work with, and I just love what I'm doing now, and just learning this new specialty and then learning how to use it to help others in different ways as well. Long-winded
Oh,
answer.
so tell me, you said you did some interpretation work in the medical field. Is that right?
Yeah.
And is that what sparked the interest to work in the medical field?
Yes. That, and I have two heart conditions. So I have SVT and AFib. So that also, having experienced people saved my life,
Wow.
and having had kids and having amazing nurses, also, and then having friends who are nurses also, kind of went like all that encompassed, all together kind of sparked the interest many years ago. And then I decided, okay, maybe this is something that I want to do once I started
Wow.
interpreting.
Well, that's a big deal. You have supraventricular tachycardia and atrial fibrillation, and so through having that cardiac issue, the cardiac issues, you've met cardiologists and nurses, and so that you said sparked interest too. Is that right?
That's correct.
Wow. Okay. So I'm interested too. You said you worked LTAC. Is that the long-term acute care? What exactly is that?
Yeah, so it's a long-term acute care facility. It has mostly like high acuity patients. A lot of the patients are ventilated. They're known for their RMLs, known for their like wound care team, and they're one of the best in the nation. And so I learned a lot about. I mean, you do everything. I was in a unit where it was mostly primary care, so you learn to be tech, nurse, everything for that patient and for the families. And with COVID, it was also a lot of mental health incorporated into all of that. You see the patient come in acutely ill with a lot of chronic diseases and some, you know, you see some of them progress and that's exciting, but you also see the other end of that and end of
Mhm.
life stages, and that's really hard, especially as a new grad. But you do everything, anything from like basic care to blood transfusions to working with an all-around team. So
Yeah, that sounds intimidating, as a new nurse.
I think
So
working as a PCT really helped because I got to work with a lot of the nurses, and then we were a kind of like a family there. So
well, that makes a difference when you have a family, a team of people to work with. But you said it's high acuity ventilators. You did blood transfusions. You went from that 8, 9 months to doing school nursing. Is that right?
high contrast, right? Yeah. I mean, I still pick up PRN here and there, and I do like to keep up my hospital skills and all that. But like, I've also picked up PRN with certain agencies doing even nursing home care.
Yeah, yeah.
It just gives you a different perspective about a lot of different types of nursing, and I got to see one end of it at an LTAC, other ends of it at an actual hospital, and then where they end up, whether it's a skilled nursing facility, a physical therapy facility, and then a lot of those are the older population, but then at the pre-K level, it's just very different, and school nursing is very different.
Yeah, I'd say so. So, Clara, how has COVID impacted your journey to nursing, and how do you feel about the field today with everything going on?
Oh, COVID. Again, my COVID experience, I was in the middle of nursing school when this happened. So I think that Morton College really did a really good job at like handling our class, even though it was a bit hard. We did advocate for ourselves a lot as students. I was part of the nursing club there, and we spoke up a lot. Like, hey, this is not okay. Hey, we need clinical sites. What can we do? How can we get out there and like talk to these people? What can we do to help? So from the student perspective, it was difficult because we lost the chance to do a lot of regular clinical rotations because they were just not available. Either the facilities wouldn't allow us in. We had to do a lot of online um, like simulations. It's just different, especially for someone like me who is a hands-on learner. I like to have that experience with like a clinical instructor where they say, here, I'm going to show you how to do it. We'll do it together, and then I'll let you do it and then see how you can learn from your mistakes, right? So, and that's exactly what I told my preceptor when I started nursing. I was like, this is how I learn. Can you please show me? On the other side of it too, because of COVID, so pre-COVID, I wasn't working full time because you can't really work full time, right? I mean, but then I had to kind of, as a mom, had to make ends meet because I'm a single income provider, in my house. So I'm like, okay, well, how do I change this out? How do I still do nursing school, work kind of full time, still gain experience, and get through this without feeling like inadequate when I end up, at the end of it. So then I ended up picking up Uber. I was picking up all those side gigs, side hustles that people do nowadays. I was doing all of them. I could pick up a little bit here, a little bit there. And then I started working. I humbled myself and said, you know what, I'm going to do PCT work. It was way lower paid than I would have normally, even if you think Uber, being an Uber driver, you can make $20, $25 an hour if you do it well, you know how to do it, execute it. And so I went from doing that to like, I'm going to take the $15 an hour and I'm going to suck it up and I'm going to do this because I want to see what it feels like to work in a hospital setting, like actually work there. And so I did that. And even though it's an LTAC, I feel like there I was going to gain a lot more experience for a lot of different things. I feel like the healthcare community for nurses don't give LTACs a lot of credit. Like sometimes they don't even acknowledge it as experience. I'm like, wow, this is crazy because we do get a lot of experience. So even as a PCT, I was like, hey nurse, I can't physically do something, like I can have you allow me to do physically something, but can I observe you? So
Right.
all the things that you learn through observation, I was able to do that. Like, hey, can I see you give that blood transfusion? Can I just sit in for a little bit? I've done all my work. Can I come, do this with you? And so they allowed me to do that. It was one-to-one a lot for a lot of these things that you would have not even have gotten in a clinical setting during a nurse rotation. So I think it just changed, but it also helped me gain a lot more than I would have had it not happened. So it was tragic. It's a horrible situation. Nobody would have wanted it to happen, but I think it definitely allowed me to learn that, hey, you learn to pivot as a nurse. Things happen and things get crazy pretty quickly. So you just learn, and that's what I did as a student, and then as a mom, as a nurse, as a person in this pandemic. So yeah, it was cool. I mean, it was cool, but interesting, but not at the same time.
Yeah, I'm hearing you talk, and so I've been out for 13 and a half years, and you caught my attention. You said middle of nursing school, and well, you said middle of nursing school, it was when COVID hit. Is that right? And
Mhm.
then you didn't really get to have a chance to do regular rotations. You had to do a lot of online classes as opposed to hands-on. And so
Mhm.
I can't imagine being a brand new nurse and then not having as much hands-on, but if I heard you right, you said that you were able to observe nurses do the blood transfusions, which ultimately gave you more confidence in your role. Is that right?
Absolutely. And I think that's one of the things that you lack as a new nurse coming onto the floor, whether you get precepted for 6 months or, I didn't get precepted for that long either. And it was due to COVID, right? You needed nurses right away on the floor. Like, and I know that that might not happen at some facilities, but here it happened for me. And I think because I previously worked there too, I think they just assumed that I knew more. And I'm like, no, I don't. No, I don't. But thankfully for me, again, because I had already worked there and built these relationships with these nurses, I was able to say, hey, so-and-so, can you help me with? Or I'm so afraid to talk to this doctor. I don't know how to communicate. I know it's S-bar.
Yeah, it's intimidating. I remember being a brand new nurse.
Sometimes, I mean, thankfully at RML, the doctors are pretty, they're just nicer and they knew me already. So I'm like, I know I'm not communicating that well right now. I'm a little nervous to talk to you. And I would just tell them, hey, like, this is what it is. But so they gave me a lot of grace for sure.
Good. Yeah, I don't know how in the world you worked and went to school. I wasn't able to work when I went to nursing school. I cannot imagine. And then you said you're a single mom too. That
Yeah,
must have been tough.
it was. I would say I give it up to my kids. For my kids are slightly older. My older two are my daughter's birthday is today. Actually, she's 15.
Oh,
Um, Thank you. And my son is 14 and I have a 7-year-old. My 7-year-old had a really hard time. He was the one getting naked in front of the camera. I'm like, no. So like it was a lot of like trying to manage and juggle. And again, you just learn to adjust because I wasn't gonna quit. And that's just not in me to quit. And we just kind of make it work. I think the hardest part for me was the emotional side. Man, am I going to bring something home? There was a lot of oh, well, so and so had this patient that you were taking care of had COVID, and but it's 2 weeks later, and like, wait, what? What do you mean? I could have brought that home. I mean, but again, I took all the necessary precautions that I needed to take as a mom, and being terrified at times, and so I would literally get undressed in the garage and have my kids bring me a bag and say, I have a whole nother different thing here. I'm gonna kind of detox and then go into the house and go straight into the shower and like manage that way.
So I see that you're an elected leader in your school district. Can you tell us about that process? How did you get involved? And why did you want to serve on the school board?
So education to me has always been my safe haven. It's always been something that I look to for comfort. Um, Knowledge is just something that I am hungry for. So as a little kid, up through my upbringing and whatnot, and so when I decided, many years ago, I started with Girl Scouts, and I met the mayor of Berwyn through that, and because his wife. I was a Girl Scout leader, and I was actually trying to promote and grow a group here in Berwyn, in North Berwyn, for my daughter who wanted to join Girl Scouts, but it wasn't available. So then we ended up creating a group, and now we're a couple groups strong. Now we have like anywhere from the pre-K level up. So it's really nice to have seen that grow, but it's stemmed from there, from one conversation with the mayor, and then also being involved in my PTA, PTO at the schools, at both the elementary and the middle school level. And then I decided to step away from it all when I started nursing school. But then again, towards like the middle end of nursing school, the mayor approached me and said, "Hey, there's this position available. I think you'd be a great fit." And I was like, "Oh no, I'm in the middle of nursing school. I don't know if I want to do this. It's a lot to take on. It's probably going to be a lot of work involved." But then I was like, you know what? I do want to be informed as to what's going on in my kids' district. How can I create change there? And there is a nurse already on the school board. She was a school nurse for a long time, and so she was also one of my Girl Scout leaders. So I was like, "Hey, what do you think?" And I started asking questions, and I knew a few people that were on the board already, and I'm like, "Okay, well, let's do this." So once I had a few conversations, and they reassured me that this was going to be something solid that might not interfere, at least not immediately, with my nursing school journey, then I decided, yeah, this is going to be something for me. So the way I was able to get my signatures. They were due like in a weekend. And because I was informed of this very quickly, and then I was like, "Oh my God, I'm gonna do this." So then I actually got all of my school nurses. I mean, I'm not a school nurse, but all of my nurses within the community and nursing students that lived on the north side of Berwyn and said, "Hey, I need help. I need to get these signatures by the end of this weekend. Could you all help me?" And through social media and like just word of mouth, I let them know my view. I was like, I want to come in and shake things up, at least give a new perspective, a different view, bring fresh eyes to things, and I think that I have the power to do that, And so I went door to door that weekend, drove around like crazy, got my signatures, got to the place, to the poll place to actually submit my bid for that, and then people voted, and I came out pretty strong, which was, I was like, wow, I was like surprised, and people were like, it was just amazing how people do respond to you, and I think I have made an impact since I've been on the school board. I've learned a lot about how the process works, how decisions get made, how difficult some of these things are, some of the controversies that come up behind closed doors that you don't really see as a parent. But now I understand from that perspective. So I'm able to now better communicate as a nurse, even in the school setting, like certain things I wasn't able to do before. But I would like to use that platform, so to speak, to encourage other things like health, fitness, things that are super important to me from the health perspective, not only in North Berwyn, but in other communities as well.
Thank you for that. I bet you are making a difference. I can tell you're passionate.
Thank you. I'm long-winded with my answers. I am a talker, if you can't tell.
So, can you tell us about your dream, specifically around creating a preventative health initiative for kids? What do you want to change, and how will an initiative like this help?
So for me, okay, so working at an LTAC, especially through COVID, I think that I saw too many too many casualties in the young age range. And I don't mean young like just like itty bitties or like anyone at 18 or younger. I meant like people in their 30s and 40s, people my age, right? So then for me, I think that creating like a preventative health kind of perspective within the community can be amplified so that the outcomes in your 30s and 40s can change, so that way you're on less medication, you're dealing with less chronic illnesses. If you implement this, let's say if I implement this on a pre-K level, if I can get not only my district or Cicero School District, which is the district that I work for, to implement something at that level with families. So changing the mindset of how people think about health and healthcare, because I feel like now it's just like we're treating the symptoms instead of getting in front of the problem. Like, for example, type 2 diabetes, we all know that's something that can be taken care of. It does not have to get to the point where you're amputating legs and turns into gangrene and you're losing stuff. You don't have to be on insulin. You can't, and all that is really expensive. If you think about these communities that suffer the most with these chronic illnesses and diseases and stuff that you don't have to deal with, that can be prevented, are the low income communities. The ones that are, have the food deserts, have these things that if we as a community kind of take care of our own, and it starts with education and it starts with implementing these things at the youngest level, at the young family level, because I know as a parent, we care about our children. We want our children to have the best outcome, but we have to stop thinking and I think just about like how are we going to live materialistically or our lifestyles or finances or that kind of stuff, but also incorporate like, do you want a long life span? Do you want to live life living life, or do you want to live life dying slowly? You know what I'm saying? It's kind of one of those things is like people are living longer, but they're living longer because they're on meds that are keeping them alive in a very bad state. How do you want to live, towards the end of your life? And some people don't think. A lot of people think that if you're thinking like 60s, 70s, 80s. No, I'm talking about 30s, 40s, and 50s. Like, how do you want to live that part of your life? And so, yeah, I think it's important to start young, implement those habits, behaviors, mindset, and then, and then continue on. So like get the pre-K to work with the elementary schools to work with the middle schools, and then keep implementing that. It takes me back. We had this training yesterday where they were talking about why school nurses became school nurses, why they brought them into the school systems. And one of the reasons was because the military had unfit soldiers when they were trying to recruit for, I don't remember which war, but they were trying to recruit. And the reason why they implemented school nurses was to make sure that by the time they were ready to recruit, that these soldiers would be fit and ready. So once they implemented school nurses, they actually had that, ripple effect of like, oh, now we have fit kids because they're 18-year-olds, right? But they're like fit now to serve. So you take the same dynamic and the same kind of thinking, and if we can change the way we think about things and the way we think about medicine, then we can then kind of set that up so that our community can think the same. And I think it starts with people like us to have that trust and that connection with the community.
Absolutely. So, Clara, can you tell us about your personality and life experience and how it's impacted you as a nurse?
Oh. So my life has been full of tragedy, full of trauma, but that hasn't stopped me from being a bubbly person. I am, I think, a very empathetic person. I think I take on a lot of people's emotions and energies around me. I am a giver. I love to take care of people. I think it's something that it just comes second nature to me. I enjoy that side of it. I think that's another reason why I think I had a lot of compassion fatigue as a nurse, and then in the hospital setting especially. But I just love it. I really enjoy giving and doing for others. So yeah, I think my life experiences, even though some of it has been really bad, I think I've experienced enough from like mentors and people that have come into my life and have shown me that, hey, you can step up for this person. You can, go out of your way to do something for some people. Have done that for me, in my lowest lows, and as a kid, as a young adult, and even as an adult now. And it was really hard for me to accept that help from people at times, but I'm learning now more and more as I change my own mindset, and I'm constantly working on myself, and I'm doing that inner work, that while yes, I can accept help, I can develop myself, and I can create change, because it was hard for me to say, wow, I can think beyond just my school, just my job, just this. I can think beyond that. And thankfully, because of LinkedIn, because of NurseSeg, because of these people that have decided to do that for me, I've been able to kind of expand my mind a bit.
Awesome. So it sounds like when I hear you talk, it sounds like you're paying it forward because you've received help, you've had other people help you, and now you're like doing it back, like giving back to the community. That's what it sounds like.
Yeah, absolutely. I like that. Yeah, I never thought of it in that way, but yeah.
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 So go ahead.
No, go ahead. I'm sorry. Somebody's, I think, knocking or something.
So, Clara, tell us about the job you are in currently. What do you like about it, and what other types of nursing are you wanting to explore in the future?
So, what I love most is interacting with the little ones. I mean, and I love my team at the school. I think it's a very encouraging team. Not knowing much of anything that has to do with school nursing, other than the the interpretation side, the IEP side, but learning more and more about, like, getting down to a kid's level, and really understanding when someone that can't speak to you but wants to communicate, learning body language. I just love all of that, and being able to console a child. I think it's some of the purest form of like love.
Oh,
It's like nursing at its like purest form, I feel like. And I can take care of them, they can feel like taken care of, and you not only feel the gratitude from the children, the students, the staff, but like from the parents. When I call them and I'm proactive and like, hey, what's happening, this is what's going on, this is what I've already done, and this is what these are some resources that I think you can use. And it just feels like I'm not only helping this student, this staff member get through the day, but I'm also helping this parent, this mom, this dad, this aunt, uncle, grandma, whatever the situation might be, to provide a better situation for all of them. And so the gratitude that I think I hear in people's voices daily, and I actually hear it because I feel like I didn't get that a lot in the hospital setting. You don't get the thank yous as much. I think that's very fulfilling for me as a nurse.
yeah, you're right. We don't. I agree. I don't think we get as much. Thank you for what you're doing, your hard work. I don't feel like we get that as much,
Right.
unfortunately. And it makes a difference on morale when you get that feedback.
Oh, absolutely.
So, as a nurse, what power do you hold, and how do you want to make a difference with it?
I think the biggest power that almost all nurses have is the automatic trust that people have with you. I think nurturing that and really valuing that trust factor is very important, because once that, it's just like any relationship, right? If that trust is broken, it's really hard to regain that. So I really value the trust that parents give me, the trust that even the staff and my facility give me, and even the community when they reach out and they legit have questions, or like through COVID, having experienced all that, like, hey, we are a team. Not only am I a team here with with, you know, your student, your kid, but I'm also a team with the staff here, and I'm a team player with you. You are important to me, and I want you to know that, understand that, and if you're willing to work with me, then we can build that relationship. I feel like all of these things as a nurse, it's all about, you know, bringing it all together, but through relationship, and then letting them know that you got them. I got your back, and I'm here for you, you know, and really, really valuing that. I really enjoy that process. And did I answer your actual question?
Yeah, you did. I was gonna say, I love your energy, your positivity, and I
Oh,
know other
thank you.
people, you know, that gives them trust in you because they know you love what you do. It shows. So
Oh, thank you.
yeah, for sure. So how do you think the nurse tech community can make a difference in the nursing field?
In the nursing field. So I was actually talking to the nurses. We had this training, and I was like, you guys all need to get on nurse tech. I think it's a super positive. If I would have had this, if I would have known about nurse tech through nursing school, it would have been amazing, especially during COVID, right? When we lacked all those resources. But for me, nurse tech, I think, provides that platform. I always tell them, it's like a Facebook for nurses, or like Insta or whatever, you know, like you have what I've learned from LinkedIn specifically, you know, you have this platform now. If you're a business and you have all these connections, and what I learned from people is like that power of connection, and like having access to people like that is incredible. Because if you are trying to make an impact, like if I'm trying to create a movement, I can reach out to certain people, you know, I can reach out to other school districts that I might not have had access to, you know, in other situations. But like now I have access, and you know that they're all nurses. They're all either nursing students, they're licensed nurses, they're nurses that have been there, done that, know how you're feeling. You're talking to people that understand you, and that's something
Right.
that you just don't get. You can't talk to somebody in marketing and expect them to understand what it was to lose a patient. You're just not going to understand where I'm coming from. You can't joke around in dark humor and people understand you. You're gonna be like, what? You know, but I think that access, that ability to network, and then to also provide what healthcare is lacking. That sense of like, I understand you. You know, you're more than just a piece of chocolate. You're more than this little thing that, you know, these administrators sometimes provide to us. And I'm not even gonna get into that, but like,
Yeah.
it's just all those things that I think we need. We're starving for the whole mental health, being able to come to a place where you're like, man, I really need, like, there was moments where I just was in a supply closet crying, or I would go into the bathroom like, whew, oh my gosh. Like, but if I could reach out to someone, like I have one of my mentors that's part of nurse tech as well, and I'd say, hey, like, I'm going through this thing right now. I need your guidance. I just need somebody to hear me out and just let me vent and give me some good advice here, because I really want to just walk out and say, you know what, I'm not doing this anymore.
Oh,
You know,
yeah.
so those kind of experiences, I think that you have access, you make those connections, you build friendships, and those are lifelong. It's kind of like being part of a sorority or something, but it's professional and it's enhancing, and it just makes your life as a nurse just a bit better and sweeter.
Yeah. So it's funny you mentioned how, you know, it's people, nurses, nursing students, it's Nurse Tech Social. It sounds like you're already on the social site. It's like a Facebook is how I describe it. But you talk with people who understand, who get it. And I've been doing this for 13 and a half years, and times of COVID has been the most stressful times. And so I can only imagine how you feel being a newer nurse, and just the stress you have, and going back to the online learning where you didn't get as much of the hands-on stuff, and you know, you're new a nurse with COVID and everything happening, and then the burnout, staff shortage. So I agree with you 100%. It's Nurse Tech community is a great place. You come to it, you talk to people who get it, you can vent. So thank
Yeah,
you for your comment on that.
thank you.
Yeah. Well, that's all we have today on Nurse Tech. Is there anything else you want to add?
So what kind of a nurse are you, and why do you love nursing?
Oh, you're so sweet. So I'm a nurse practitioner. I work long-term care. I'm a chief education compliance officer for my company. I'm an author of geriatric notes. It's specific to geriatric nursing. New doctors read it, new NPs, PAs. It talks about non-drug measures and the pharmacological interventions. It's a lot. Everything's changing. Even the USPS task force stuff has been updated, like on aspirin. So once the second edition comes, hopefully we're waiting on the final thumbs up, but that's what I do. I practice full time and I write and I keep my medical book up. So that's what I do.
That's amazing. I love that. Well, thank you for, not changing the way things are going. That's amazing. So I love when nurses go beyond just, whatever they start with doing. So like you've gone above and beyond and you're making a change or creating change. And I think that's wonderful.
Well, I saw the need there. It's like their gap. Like you learn in school and then you try to practice and then trying to fill that gap. Nobody can really teach you that. You got to get out and practice, get your feet wet. And so the book helps to connect the gap, so to speak. So if someone's confused, it's a nice reminder. Don't forget your B12, your TSH and all that stuff. Because it's when you're seeing all these people, it's stressful. So it's like a little nice reminder. But thank you so much for your time today on Nurse Tech, and I'll see you on the community of, Nurse Tech. So thank you so much.
Absolutely. Thank you. Have a good day.